Hi, my name is Tracy Cundiff. It is October 28th of 2019. I'm a 7th semester nursing student, and today I'll be demonstrating the use of insulin pens and mixing of regular and NPH insulin to administer for a patient, a diabetic patient. So if you have a patient with diabetes, always throughout the day monitor them for signs and symptoms of hyper and hypoglycemia. You also want to check their blood sugars before you administer any type of insulin. And if you're giving rapid-acting insulin, you want to make sure that they have a meal in front of them or a meal present that will be eaten within the next 5 to 10 minutes before giving the insulin. Always introduce yourself, name and date of birth for your patient to identify your patient correctly, and do all of your med checks that you would normally do with insulin as you would with any other drug. Both in the med room and at the patient bedside. So if you have a patient that's using these insulin pens, from what we were told, they are typically kept in the patient's room with them. They are needleless systems. So when going into a patient's room to use their insulin pen for them, again, blood sugar would be checked. You want to roll this pen in your hands 10 to 15 times. You also want to clean the tip of the pen before you apply your needle. These pens should not be shared between diabetic patients, just like syringe systems should not be shared. So, clean your tip. We're going to open the needle here. Being very careful not to stick yourself. And apply your needle. And then I like to remove the caps when I prime it so that I can be sure that the needle was primed, that I can see. So then click your insulin pen to 2 and press down to prime your needle. So now that my needle is primed, I like to recap using fingerless, of course. You don't want to stick yourself with an insulin pen and then fall out. Excuse me. Trying very hard not to bend this needle. So recap this. This stays capped until you're in your patient's room and ready to administer it. So this patient's going to receive 5 units. 4, 5 clicks there. I'm hoping that you can see here between the 4 and the 6. There's the 5 units. So I would go into my patient's room, again, identify your patient name, date of birth, ensure that you're giving the correct number of units, scan your med, do your med checks at bedside, and then I want to know where they last administered their insulin. So if earlier this morning they got it in their left lower abdomen, I'm going to rotate to the right. So rotate your site. You don't necessarily want to rotate anatomical positions, because if you gave it in the arm this morning and now I give it in the abdomen, that affects their ability to absorb it in a consistent manner. So if you're going to use the arm all day. If you're going to use the abdomen all day. Don't rotate between arm and abdomen and arm or legs. Use the same anatomical part of the body every time that you administer during the day. So this person did left lower abdomen, so this time we're going to go to the right lower abdomen. So expose the skin. Pardon me. Wash your hands first. So I'm going to wash my hands. I like to put on a set of gloves. Expose their abdomen. Clean your injection site. So clean their abdomen off. Let that air dry. Don't fan it. Don't blow on it. Let it naturally air dry so that it's actually disinfected properly. And then remove your cap. Alright, this table is not very level because the cap's trying to roll off. And then you want to pinch their skin, go in at a 90, and then pinch down till the clicking stops. And hold 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and you can remove. Then you want to recap this system, not using your fingers. And remove your needle, which is not always the easiest part for me. So remove your needle, and then you want to put this needle in the sharps box Of course, I'm not going to be able to get it off now. And then I could not find a sharps box in this sim lab. There's lab going on elsewhere, so we're just going to pretend that I have a sharps box. I will throw it away in the sharps before I leave. But you want to throw this needle away in your sharps container. And every patient, when they're at home, should have their own version of a sharps container. So then once this is, the needle's off, recap it and put it back where you found it for the patient. We'll go into now mixing insulins for administration. So when you're mixing insulins for administration, most hospitals have that sliding scale that you would use. So test your patient's blood glucose levels and use your sliding scale to determine how much insulin to give. If you're mixing insulins, obviously always draw up your clear before you're cloudy. Insulin pens come in small unit increments. So today we're only drawing up 12 units. So I'm gonna pull a unit syringe that is smaller so that I can measure more accurately. They make unit syringes that are much larger. They go up to 100 units for patients that receive high doses of insulin. So for this type of administration, you go into your med room, you find your appropriate insulin vials, do your med checks. The cloudy insulin always needs to be rolled. So again, just like you did your pen, you want to roll this 10 to 15 times in your hand. Make sure that it's well reconstituted or well mixed. So roll this, don't shake it. Just roll it nicely in your hands. Clean the tops of your vials with alcohol. So uncap them, clean them, because these are multi-use vials, so you want to make sure they're good and clean. A lot of times in the hospital, I even use 2 different alcohol swabs to do this because I'm anal. So clean. And again, like I said, you're going to give, so we are giving 4 units of regular insulin, 8 units of NPH. So what I want to do first is draw back my 8 units of air. 8 units of air, and then I want to inject that into my cloudy. Trying very carefully not to bend these needles, they bend so easily. So inject 8 of air, and then again I will pull back 4 units of air and inject that into my regular. So inject your air, and then I'm immediately going to turn over and pull 4 units of regular insulin. Trying very hard not to pull bubbles with this. If you do pull a bubble, tap it out. Our book also talks about pushing back on the plunger and pulling back several times can sometimes reduce the amount of bubbles that you get, or the bubble that you may get at all in these syringes. So use whatever trick works best for you. But you have to get the bubbles out. Also trying very, very hard not to bend these needles because they bend really easily, and the more times you use them to poke vials, the more dull they get, and then we have an issue with, then you have an issue with, there goes my bubble. A dull needle being inserted into your patient, which is extremely painful for them. So be very, very careful. So I have 4 units. I'm so sorry, I'm not sure how the best way to get you to see that this is 4 units of clear. So then I will place this into my cloudy again, and then we are going to draw back 8 of cloudy, giving you a total of 12 units of insulin. Be sure that you do not push your clear insulin into the cloudy insulin. Doing my best here not to get bubbles. Okay. So then this is 12 units of insulin. So you want to have this checked by a nurse to verify this before you give this to a patient. Same with these insulin pens. I've seen in practice that a lot of times nurses don't have this unit checked before they administer. Always have your units of insulin checked to make sure that they are the correct number of units before you administer that to a patient. So a second nurse needs to check that. So recap using the fingerless technique till I get into my patient's room. Again, rotate sites. Ask them where they last had their insulin administered. You want to check their glucose before you administer insulin. So again, if they were going to say they use the abdomen, we're going to rotate to the left or right lower quadrant, depending on where they last gave it, or even if they have enough subcutaneous tissue, fat tissue up here, you can do the uppers. Again, wash hands, don clean gloves. Not everybody does that. I like to do that. Clean the skin, allow that to air dry. Don't blow, don't fan. Pinch your skin, uncap. Be very careful. Pinch your skin, 90 degrees, and inject your insulin. Remove your needle. If you have a patient that is very, very thin, which is myself, who doesn't have a whole lot of subcutaneous tissue, say they're thin, say they're cachexic due to illness, or they're older and frail, if they don't have enough subcutaneous tissue to do a 90-degree angle, you can lower your angle to 45 to be sure that you don't inject that insulin where it should not go. And you don't have to aspirate for blood when you're doing these injections. So that is it. Thank you.